Hello, I'm Dr. Robert Cagle. I specialize in joint replacement surgery with the MAKO robotic assistance, and this is my good patient here, Kinji. So if you can just give us a little introduction about who you are and what we did for you.
Yeah, my name is Kinji. I'm 38 years old. Been suffering with hip pain for the last 8-9 years. Finally decided to really take a deep dive into what is the best way hip replacements can be done and who's doing them. And so I did my research, found you using the latest technology. And of course, everyone's a little anxious about going underneath the knife, but I'm really happy I did. And I'm about 4 weeks out now.
Perfect, perfect. So if you can just describe, what was, when you say hip pain, like what was the activities of daily life, or what was the defining kind of characteristics of what made you to say, okay, it's time to get my joint replacement?
Yeah, I mean, for maybe the last 2 years, anytime I ever dropped a pencil or a pen, or anytime I had to tie my shoe, I just took a deep breath and knew I was going to be in some pain just to do some really basic functions. But last summer, I was just swimming with my 2.5-year-old daughter, just treading water, and then for about 2-3 days, I couldn't go to sleep without any painkillers just because my hips were on fire. And I was like, I'm tired of this. I can't even play with my own children, and I need to take care of it.
And then did you do any conservative treatment or anything before having hip replacement surgery?
I tried an HA injection. I tried cortisone, which was very temporary. But eventually I just knew the x-rays were showing that, and all the doctors said if you can wait the longer the better, but everything it was just a band-aid for the real problem.
I always like to ask, if you have any advice for people that have arthritis or suffering and they're contemplating a joint replacement, what advice would you give them?
Yeah, I think my biggest regret is not doing it sooner. Being in as much pain and really just agonizing to do little things with my daughter. Not enjoying the 2.5 years. I got a lot of years with her, but just honestly not doing it earlier. How well it feels now.
Wonderful.
My advice would be is do your research, talk about it. I think where your parents thought of joint replacement and where it is now, I think it's a completely different story. For me specifically, I would have no hesitation to get my left done sooner than later, just so I can live a active lifestyle with my family. But I would say do your research, feel good about it. It's not what you used to think it is, and it's just with the new technology and everything out there, new procedures and new approaches, I think it's just completely different.
Mm-hmm. Yeah, I think that with the robotics and then combining it with the minimally invasive direct anterior approach that I call the cosmetic hip replacement, I think that's really changed the game for hip replacement surgery. One final thought: would you have any hesitation or recommending Dr. Cagle for hip replacement surgery or knee replacement surgery?
No, absolutely not.
Wonderful.
First got to go. Sure.
Perfect. Well, thank you so much, man. I appreciate your time. I appreciate you trusting me with your care, and really appreciate everything.
Looking forward to doing the next one.
All right. Perfect.
All right.